Are you currently suffering from pain on the outside of your thumb that's aggravated by such activities as opening a jar or pulling on your pants? These are common symptoms of tendonitis of your thumb. If you've never had thumb pain, it's kind of like your big toe. You don't realize how much you need it and use it until it hurts. And it can make life really debilitating quickly. For those who don't know me, my name is Dr. Zach Green here at Performance Sport and Spine in Seattle, Washington. In this video, I'm going to show you how you can accurately and early diagnose this condition, while simply rest is not the appropriate treatment, and then the best exercises to get this back and out of pain. The Quervain affects two tendons, one along the top or back side of your thumb and the one along this side. And even though the tendons run from your fingernail up to your wrist, the muscle's actually up in your forearm, which is why sometimes people experience pain in their wrist or up in their forearm. How do you know if you have the Quervain? Well, you're going to have pain on the back side or lateral part of your thumb, and it may go down into your wrist or the forearm where that muscle is. There may be some swelling, which is the tendon swelling up to protect itself, increasing the surface area. You may have some difficulty moving your thumb or wrist. Severe cases, there might be a catching or popping sound, and this is going to be aggravated with activities of gripping or twisting, and it's often better with rest. This is most commonly found in mothers with newborns or females between 30 and 50 years old. It's also very commonly seen in people who have manual jobs such as carpenters that hammer a bunch or twist a wrench, things that grip excessively. There's an overuse component, and it's commonly seen in this. The pain that you're experiencing with this is happening for two reasons. So first, the tendons themselves are getting mechanically overloaded. Again, this is mechanical, not inflammation, which is why tendinopathy is a better term than tendonitis. Secondly, that tunnel that those tendons get through can thicken and cause more compression. And there's one thing tendons that are irritated don't like, it's tension and compression at the same time. This is going to be seen with people that do excessive amount of gripping or twisting, but there may be some other predisposing conditions with genetics and hormones, and things like rheumatoid arthritis may predispose people for this. With tendon issues, they can be anywhere from acute to chronic, and it changes how you're going to treat them. So acute, think you've had pain for a day or maybe a few weeks, and there's probably something that you've done recently with a lot more gripping or twisting. The tendon's irritated. The best thing to do is to calm the tendon down. And the first thing you want to do is find those provocative activities. Say you started like a weaving class or you've been working on your car. You want to do that a whole lot less. 50% is a good reduction rate at first. NSAIDs and icing may also help, but you want to calm that tendon down before you do exercises to strengthen it because it's irritated. Now let's say you've been working for 6 months and the tendon still is hurting. Now we're to more tendinosis. There's been structural changes to that tendon, and that dead part or that silent part of the tendon can't be changed. You may have heard the term treat the donut, not the hole. So the other part of the tendon, the healthy part, can actually get stronger and bigger to compensate. That's when these exercises are going to be paramount to help strengthen that tendon and improve the capacity. For the rehab, we're going to break this into two sections. The first part is going to be with weights and a band, and the second is require PT Putty. Now we put this link in our video, but if we have this condition, we can't recommend this stuff enough as it's a game changer for the exercises that we're going to do. Radial and ulnar deviation. So with your forearm supported with a light weight, we're going to tilt the weight down towards the floor, slow and controlled, and then tilt it back up towards the ceiling. When doing this, your pain should not increase, so adjust accordingly. Try to go full range of motion down, slow tempo, 2 seconds, and then up 2 seconds. Weighted supination pronation. With your arm supported in a light weight, we're going to rotate our hand all the way 180, slow tempo, pause, and then return to the starting position. Again, the pain should not increase during this exercise, and if so, adjust accordingly, but at slow tempo, as far one way as you can, pause, and then return to the starting position. Isometric thumb extension. So with your affected thumb here, we're going to place the other hand against the back of the thumb, keeping the knuckles straight, and then feeling tension here, we're going to press our thumb up into our hand and hold for 10 to 20 seconds. Again, the pain should not increase during, adjust accordingly, but you want to feel tension on the back of the thumb. Isometric thumb abduction. If this is the painful side, we're going to bring our thumb a little bit away from our fingers, and then take our other hand, place it on the outside of the thumb. We're going to press our thumb inwards towards our other hand and hold the tolerance. Again, your pain should not increase during this exercise, so adjust how hard you press accordingly. For this exercise, you're going to need a PT band that you're stepping on one side, and then we're going to take it over our thumb and then pinch it between our thumb and our fingers, and you're going to keep your thumb pressed into your fingers with your arm at 90. We're going to curl upwards, and you're going to feel a lot of tension right here. Pause, and then return to the starting position. Again, slow tempo of 2 or 3 seconds. And again, you want to adjust how hard the band is or how stiff the band is so your symptoms don't decrease during the exercise, but you want to feel tension along this part of the thumb as you do it. With this putty, there may be different colors or different levels of kind of stiffness of the putty. Always start with the easiest and then gradually progress to the more stiff versions as your tendon gets stronger. Don't just jump into the stiffest because you'll overload it and just make your pain worse. Now we're going to start the putty rehab. And so that putty that we have linked in the video, you're going to want to make it into a ring for the next 2 exercises. Thumb extension. Thumb abduction. Try to move just your thumb and not your fingers. For the next 2 exercises, you're going to need to put this putty into a ball. Thumb opposition. So taking your thumb, press it down in towards the putty to the base of your little finger or pinky. Again, press nice and slow and press as far as you can, but your pain should not increase during. Thumb extension. So taking your affected thumb, press it into the putty, and then in an up and J motion, press your thumb up and curl, pressing through the putty. Feel tension on the back of your thumb. And again, your pain should not increase during this exercise. That putty, we're going to make it into a pancake now. And then for the finger spread, we're going to place all of our fingers into it. And then spreading your thumb primarily, but the other fingers as well. We're going to spread that apart as far as we can to tolerance. Again, making sure the pain does not increase during, but spread your finger far. When doing tendon rehab, some pain or discomfort is the norm, not the exception. So how do you know if the pain you're experiencing is safe? Well, here's 3 really helpful tips that you can use to kind of know if your rehab is going to be optimal. So the first one is the pain should be mild. It should be 4 out of 10 or less during the rehab. Within about 2 hours of being done with your exercises or rehab, the pain should be back to normal. And the next morning that you wake up, the pain should be baseline or better. If your pain is exacerbated afterwards, or the next day you wake up and your thumb is super achy, that's your body saying you did too much too fast. You need to wait an extra few days and then start at a lower dosage and then gradually increase. Again, tendons like small incremental changes over long periods of times rather than sudden drastic changes. So with this, if it's a more chronic case, be patient. It may take a few months, but each week or each second week, make sure your exercises are more intense or more challenging. Don't just add more reps. Go slower or make the resistance heavier. How do we know if we're diagnosed this properly, as there's other conditions that can affect your wrist? So historically, 2 popular tests are the Finkelstein test and the Eichhoff's test. But it turns out these aren't very specific, meaning they're very good at saying that something's wrong, but not very good at saying what specifically is wrong, like is it a tendon or ligament or a muscle. A better test has been developed called the wrist hyperflexion and thumb abduction test. So this is the test that you should use. To see what the best health of a tendon, ultrasound is the preferred method, but some severe cases may require an MRI. Typically, x-rays are not recommended for this as they just see bone, and this is a tendon or soft tissue injury. Lastly, we're going to talk about taping, splinting, and bracing. And since this is an overuse injury, there may be some application of using this, especially for those that can't rest. So say if your job requires you to use your hand, you can't simply just take half the days off. So this may be applicable, especially in the acute sense. Now, one thing to note with taping and bracing is you want to do it as little as possible for the least amount of time. Again, if you just completely immobilize that tendon, you're going to make it weaker. And even though the pain may get better, the tendon is getting weaker and the capacity decreases. So once you take that brace off, there's going to be deconditioning, and you may predispose yourself for even more pain down the road. Research also shows that women that are pregnant or postpartum will benefit from this even more due to the hormonal changes that they're going through will change the tendon. So bracing or splinting them is very effective in kind of giving them some time off, as well as doing a young kid means you're using your hands and thumbs a lot. That's it for today. We hope you found this video was helpful. If you did, please like the video, subscribe to our channel, and then don't forget to check out our other great videos.